We are now live. So if we missed the update, we're here with Kendall Troyer from Spectrum Health Lakeland and Nicki Britten from the Health Department. So I'm not sure if we missed Nicki's update, so I apologize, Nicki, if you want to run real quick through what we're seeing here locally in terms of case numbers.
Yeah, no problem. So we have continued good news. We are continuing to see the downward trend in positive COVID-19 cases. We're down under about 20 new cases per day, and that continues to be really, really encouraging. It is a far cry from where we were in November. At the same time, we're seeing that the decrease in percent positivity, we're below 5% now. As you would expect, with fewer cases, we're seeing a lower percent positivity. Testing still remains at a good level. We're still having several hundred tests per day happening in Berrien County. So don't forget that testing is still available. And if you need testing, you can seek that out on our website. There's a wide variety of locations. If you need to see that, you can find that on the health department's website. But overall trends are really encouraging. And we're seeing similar things, I believe, with our patient census at Spectrum Health Lakeland as well.
Yeah, Nicki, we are, those trends that you're seeing with positivity and with case numbers in the county then translate to the hospital. So our rolling 7-day average is at 13.3 right now, which is the lowest it's been in a long time. Our current census today is actually at 12. We have 12 COVID positive patients in-house with 5 who have tests that are still pending, but just a really different place than we were at. And I guess I want to thank the community. When I'm out and about now, I see a lot of people wearing their masks. And we here at the hospital, we appreciate that. The team's been really stretched over the last couple of months. And it's nice to have this little bit of a breather to be able to get back to providing wellness care, which we want to be able to do. So definitely seeing those trends move in the right direction. Really appreciate the work of the health department in partnering with us.
Thank you both. And we know that vaccines continue to be a big focus. Nicki, can you review for us which groups of our population are currently eligible to receive the vaccine and how that progress has been going here in our community?
Yeah, I'm going to share this graphic. This comes from the Michigan Department of Health and Human Services. You can find this document on the state's website, michigan.gov/COVID vaccine. This information is also on the health department's website as well. But there's a bit of a timeline here to try to cover when people are eligible and show when different groups are eligible for vaccination. As I'm sure most of you are aware, we've been working through this phase 1A, which is healthcare workers and long-term residents and staff. So that has been well underway for almost 2 months now here in Berrien County. And we've got some good coverage there. And then starting in January, we had adults that were 75 years and older that were not part of 1A. We have some frontline responders, police, fire, medical first responders, and then school and childcare staff, which we are continuing to work through that process of vaccinating those groups, corrections staff. And then Michigan Department of Health and Human Services did bring 65 to 74-year-olds from phase 1C to eligibility at the same time as some of these phase 1B individuals. So this is who's currently eligible, as you can see with this timeline. Starting Monday, March 1st, MDHHS has announced that there will also be agricultural and food manufacturing processing workers that are eligible. This is really geared towards food manufacturing settings where the nature of the work does not allow for any social distancing. And a lot of these types of facilities, we don't have as many in Berrien County, but a lot of these facilities throughout the state had significantly large outbreaks in the spring and the summer and the fall due to the working conditions, really unable to mitigate that risk. So that's who's targeted there. There are other essential workers that are in phase 1B, group C. We are not yet to them. And that the MDHHS is predicting that maybe in April is when those groups would become eligible. Those groups include things like critical manufacturing, public transit, grocery workers, as well as the postal service. So those groups we're preparing for, we're doing the planning and we're prepping for it, but the state has not yet made those groups eligible. And again, according to this timeline, we think it might be April. And one thing I guess I'd just add for our listeners is that the things that go into these recommendations and these eligibility, it's not, especially for workers, it's not just a matter of do you have exposure to the public, but there's also a vulnerability that comes into play there. Remember that our main goals with vaccination, number one, is to protect the healthcare system from overwhelm. We don't want to overwhelm our health system so that we have adequate healthcare resources to meet all of the health needs in our community, COVID and non-COVID related. And then we also want to protect the most vulnerable from severe illness and morbidity. That serves to both protect residents as well as reduce some of the strain on the health system. And then we want to maintain that certain critical infrastructure as defined by the workers eligible according to Mdhhs. So I know we're hearing from a lot of folks who are saying we have lots of exposure to the public, we want to be vaccinated. We're eager to vaccinate you. It's just not time yet. So continue to bear with us as we move through that. Based on who is eligible and just how we've been progressing through these groups, there have been a total of 32,000 doses of vaccine administered in Berrien County. That does include first and second doses, so that doesn't mean 32 individuals have been vaccinated, but that is a tremendous effort in about 2 months' time. That really does represent 17% of our population, 16 and over, which you have to be at least 16 to qualify for or be able to receive the vaccine, although not many people that young fit the qualifications. But the fact that we've got 17% of our eligible population by here at the end of February, I think is pretty phenomenal. And we are also doing well targeting those over the age of 75, who we know are at the highest risk of severe illness and death. About half of that group has received a vaccine, and that puts us at 6th in the state in terms of vaccinating these older adults. So we're continuing to work through this. We are definitely meeting the benchmark of 90% of vaccine is administered within 7 days of receiving it. A lot of times it's much closer to 100% than that 90% benchmark.
Thank you. And we've been hearing a lot about the state of Michigan's strategy to help enhance equity in the vaccine distribution here in Michigan. Can either of you shed some light on what this strategy looks like and what are the main priorities that we are trying to achieve?
Yeah, I mean, I'd be happy to start us off. And I think I speak for both of our organizations when I say we were very pleased to see that equity was such an explicit part of the state's vaccination plan. That's something that is important to both of our organizations. Health equity has been worked into a lot of how we operate. There's always room to continue to do more, but that's something that is important to us and how we operate in our community. So we're pleased to see that from the state of Michigan. The Mdhhs strategy really has 5 principles to it. It's that all Michiganders have equitable access to the vaccines, that vaccine planning and distribution is inclusive and engages state and local government, public and private partners, and draws on the experience and the expertise of leaders from historically marginalized populations. The third is that communication is transparent, accurate, and that there are frequent public communications to help build trust. Number 4 is data is used to promote equity, track progress, and guide decision-making. And the 5th one is resource stewardship and efficiency and continuous quality improvement to drive strategic implementation. All of that can just sound like a bunch of jargon, but it really is taken to heart here in Berrien County to make sure that we are really ensuring that there is equitable access and that people who need the vaccine are not being left to the side because of barriers or other things. And it also recognizes that this public health effort is a team sport, and it's not just the 2 of us on this team, our 2 organizations. There's so many partners out there. Kendall,
Yeah.
what would you add to that?
Yeah, talking about partners, I would just add that, the federal government is starting to distribute vaccine directly to federally qualified health centers. So in Berrien County, we have Intercare. In South County, we have Cass Clinic. In the near future, they will have vaccine to be able to begin vaccinating their patients, which really is a federal program to target, again, vulnerable populations. And you really do have to be intentional. You just think about our intake process because of the volume of community members we're trying to reach. We rely on electronic means often. For us, it's MyChart. For the health department, it's a web-based sign-up. And if we're going to reach vulnerable populations that don't have access, there's that digital divide that some folks are on the other side of. It takes very intentional planning and effort to give them the same opportunity for vaccine that you and I may have just through the normal course of our availability on Facebook or on internet, or the way that we're connected to the world is just a little bit different. And that takes work, that takes intentionality if we're gonna get into those communities and be able to reach everyone.
And we're going to go ahead and break down each of those principles that Nicki mentioned a little bit more and how it applies to the work that we're doing here locally. So the first is ensuring that all residents have equitable access to the vaccine. And this is a multi-pronged approach with many ways to distribute the vaccine. So Kendall, do you want to start and just share where we're giving out the vaccine and how that process is?
Sure, yeah, and I'll use the word intentional again. So, between Lakeland and the health department, again, it's much larger than that. There's pharmacies that are involved, there's FQHCs that are involved. But with the two of us, we intentionally try to plan and coordinate so that we're hitting all communities. The mass vaccination clinics are, the way we get a high volume out, and both the health department and Lakeland are operating those. Lakeland has partnered with Lake Michigan College to provide mass vax clinics both in the St. Joe Benton Harbor area as well as in the Niles area. And there's a number of other things that the health department's doing that Nicki can speak to. I just also want to mention the Center for Better Health, which is in Benton Harbor. And we are doing, it's a smaller scale vaccination there, but it takes a lot of kind of community outreach and to do, it's not a mass vax, but it's a daily where we're able to do consistently offer vaccination within that community. We've also been trying to get into patients who are homebound. So I think we probably mentioned this on other Facebook Live, but getting lists, partnering with PACE, partnering with Area Agency on Aging, identifying community members who can't get out of their home, and then going out and vaccinating them where they live.
Yeah. And I think, Kendall's hitting the nail on the head there. You have to be really intentional, and we have to be really diverse in our efforts because there's not a one-size-fits-all approach. And sometimes the stories that we see of what's working well and the images we see in the news, it's really about these mass clinics. And there's a lot of advantages, and mass clinics do work for a lot of people. And it is a good way to get a lot of people through in a short period of time. But we also know that strategy doesn't work for everybody. The electronic sign up to be able to get to a mass clinic doesn't work for everybody. So some additional strategies that the health department has taken lead on, but it's definitely been in partnership with Spectrum Health Lakeland, especially the population health team. We're doing a lot of community-based clinics, targeted pop-up clinics, where we're actually partnering with a community agency, whether it's a senior center or a church or housing communities. We're working to bring the vaccine to where people are. We know that helps overcome some of the barriers, which are some of those other strategies there. But we're really trying to make sure that we can get the vaccine to where people are, because not everybody can come to where the vaccine is. So we've been doing a lot of those sorts of things. Our efforts are not perfect. It's definitely continues to grow and be a work in progress. Bringing on and having additional partnerships, growing and strengthening our partnerships continues to be really important. And a large part of this is not just how the vaccine is actually going out, but it's also the communication about how the community wants to receive the vaccine and could access the vaccine. as well as what we have available information to address vaccine hesitancy. So there's a wide range of things, and there's a lot of thought across a whole spectrum of how we can try to do this, but it absolutely has to happen in tandem with the community.
Yeah, and in a context where we still don't have enough vaccine. So I know, we saw some releases yesterday. The state of Michigan is getting a bit more in the coming weeks, but the collective we in Berrien County has the capacity to administer more than we have. And I know I hear from folks that, their grandma, their grandpa themselves signed up quite a long time ago, and neither the health department nor Lakeland has reached out to them yet. We wish we could, but we don't have enough vaccine yet to be able to even vaccinate all those 65 plus, 75 plus individuals that are on our list. So we're hopeful it's turning around, because we've gotten to 50% of them, but you'll continue to see an acceleration of that vaccination pace.
Yeah.
Thank you. And moving on to the next principle of that strategy, how are we actively engaging state and local leaders, including those from historically marginalized populations, in the conversation around vaccine?
I mean, I think this goes back to partnership. We definitely see ourselves as stewards of this vaccine, which is, that last principle. It's maybe in our hands to be able to administer, but at the same time, this is a community product. This is a community resource. And so we are really having intentional partnership with leaders. We have partnerships with churches, church leaders, their congregations, other community-based organizations. There have been some groups of just community influencers, informal leaders that have been engaged since the beginning of the pandemic and helping to drive some of this response. We've engaged additional stakeholders. It really is about being intentional, going to those community leaders and saying, there's some decisions that we as the stewards of the vaccine need to be making. How can we make these decisions together so that we get to the best end product for everyone?
Yeah, and I mentioned the Center for Better Health in Benton Harbor, and just to highlight, that's grant driven. So that was established on a grant by the Michigan Coronavirus Task Force on Racial Disparities, and we were able to stand that up in October of 2020. So again, this is bigger than any of us individually, and it's leveraging resources from outside of the community, from within the community. And then there's simple stories too, like I hear about Benton Harbor community advocate Tracy Berrien, who brought together some local artists and to develop a COVID-19 safety and health awareness communication. So, as individuals, we can make a difference. And then as a collective, organizations, we can make a difference, and we can leverage what's available to us from state and federal resources, as Lynn Todman and her team did with the Center for Better Health. So it takes all of us.
And we've touched on the fact that no one communication outlet works for everyone. So what are some of the ways that we're ensuring that our communications are transparent, accurate, and are helping build public trust around receiving the vaccine or questions that people may have?
Yeah, so I guess one of the first things that I would say is that we do understand that there are people in our community who may choose not to be vaccinated, and we do support that right for them to choose whether or not to be vaccinated. But we also know that there's a lot of misinformation out there, and we would hate for misinformation to be driving a decision not to be vaccinated. We really want people to provide informed consent or informed dissent based on what is best for themselves. So like you said, Jessica, one form of communication, it doesn't reach everybody. There is no one size fits all. So we have this multi-pronged approach to communication. There's some of the information on websites and social media channels and working with mainstream media that's going to get at a swath of the population, a certain percentage. We're doing these sorts of regular videos, so if people don't want to read their news and they want to listen or watch some becoming familiar faces, that they can do that. But there's also just some more labor intensive and other more direct forms of communication that are really important. We're starting to do things where there's flyers that are going to schools to be able to share with families that way. There have been the community influencers that I talked about that have the ability to have accurate information so that they are then able to share accurate information within their spheres of influence. But we also have a hotline phone number for people who really just want to call Lakeland or the health department to get some more information or ask some questions or access things that way. And we're having printed communication in both English and Spanish because we know we have a Spanish speaking population. We have a lot of people with that don't speak English as their primary language, and we need to make sure that language is not a barrier. So there's a lot of those sorts of things. There's a lot of one-on-one meetings that are happening or visiting certain groups to try to have some communication about the vaccine and vaccine efficacy. We're trying to, in the same way, meet people where they're at in terms of needing vaccine. We're trying to meet people where they're at in terms of how they want to be communicated with and how they receive their information.
Great. And how are we using data throughout this entire process to guide some of our decision making, or what are some of those data points that we're looking at?
Yeah, I mean, data is definitely important because we do want to make sure we're making decisions that are rooted in what is happening. And so there's a lot of data out there, and it's really about making sure we're applying the right data and looking in the right ways and understanding the context. One thing that is really happening and that we're utilizing is a social vulnerability index that is from the CDC. And the social vulnerability index, or SVI, it is a way to target outreach to specific zip codes or census tracts that might have higher risk of poor outcomes in any type of disaster or something happening to a community. A pandemic certainly fits within that. So it identifies communities that might have more difficulty in preventing human suffering and financial loss in those situations. So there are things like housing makeup and education levels and poverty levels and racial makeup and all sorts of things, data points to go into this index to really predict a community's vulnerability. So we know that places in Michigan, census tracts in Michigan that had the highest SVI also had the highest rates of COVID-19. And so there is definitely a demonstrated need to prioritize those parts of our state, those parts of our county. So we're using that data to drive a lot of that decision making and targeting some of the key places for outreach and for partnerships to make sure we're getting vaccine out in very meaningful ways in those locations, not at the expense of not doing anything for the rest of our county, but it's really important to make sure we have something that works well in those communities with a high SVI. There's also lots of other data. I know, Kendall, you all are using data to drive so much.
Yeah. Well, yeah, we use the data to drive where we want to go and to identify, as Nicki described, the vulnerable populations. Then we also use data to assess who are we reaching. So if the SVI helps us identify a community or a population that is at higher risk, we then look at our vaccination. Who have we actually vaccinated, and are we reaching those communities? As we're trying these different tactics that Nicki highlighted, we can use data to say, have we been successful, or did we try this, it didn't work, we need to try something else. So we use data both on the planning side and we use data on the assessment side. And then from a state level, we report through, it's MICR, but through the reporting process to the state, who we're vaccinating and demographic information on those that we're vaccinating. And they're checking us to make sure that our efforts are producing equitable results. So it's definitely a data-driven process, both in the planning and in the assessment side, and it's tough work.
Thank you. And we know that we mentioned a couple of times that vaccine supply continues to be very limited. Can you both speak to how we're ensuring that our resource stewardship and efficiency, that we're doing that equitable, and just what kind of vaccine that we're getting here in Berrien County week to week?
Yeah, so one of the biggest things that I think we're doing in stewardship of this scarce resource is we're sticking closely to the original ACIP, the American Committee on Immunization Practices. We're sticking really closely to those ACIP recommendations that is then driving the prioritization and eligibility groups from the state. Those groups were chosen, and in that order, in a manner that then fulfills those three goals I mentioned at the beginning: to prevent the overwhelm of the healthcare system, to reduce death and severe outcomes for our most vulnerable individuals, and to maintain critical infrastructure. So by following those goals, following that prioritization, we are staying focused on those goals. If we were to just start vaccinating everybody or start to loosen up those guidelines, we then lose focus on that goal. And when you lose focus on a goal, it just becomes harder to attain it. So we don't want to dilute our efforts. We want to stay focused. Staying focused on those goals does help everybody. It's not just for the people who are vaccinated. So that is probably the biggest way that we are remaining or stewarding the vaccine and being efficient with what we're doing. A couple of other things, I mean, we remain committed to only scheduling a first dose appointment if we know we have the vaccine, if it's already been allocated to us. So that's why there aren't appointments weeks and weeks out that are scheduled. It's because we want to make sure we have a vaccine available for you when you have that appointment, so you can have that assurance. We did have a hiccup earlier this week where we had to reschedule some second dose appointments due to shipping delays, but we are committed to making sure that those first dose appointments stick. And a second dose vaccine, even if with that shipping delay, the vaccines have arrived, we do have them on hand, people will get their second dose.
And when you think about, protecting the health system from being overwhelmed, I would say in early December, we were overwhelmed. We were taking care of patients in non-traditional places, and our entire focus was on caring for COVID patients. So that age banding and the priorities that Nicki has laid out are very helpful. The older individuals are much more likely to be hospitalized due to COVID, and they're much more likely to die due to COVID. And so starting in that way keeps us grounded and focused. I like that word that you use, Nicki, focused in our approach and in our distribution of vaccine, which at this time is a limited resource.
Thank you. And we're coming up on time here. So maybe just remind everyone of, if they are interested in getting the vaccine, what are the steps that they should be taking right now to be prepared, and then sharing any closing thoughts that either of you may have.
Yes, so for appointments through the health department, everything is by appointment and only, as it is with Spectrum Health Lakeland. So we don't do walk-ins. But we are working through our survey lists, our wait lists, to make sure that people who are on those wait lists are able to get an appointment, have an invitation to be able to register when there's vaccine available for them. And you can find information about that on our website, www.bchdmi.org/COVID-19. We also have a hotline if internet does not work for you. It's 1-800-815-5485.
And similarly, for Lakeland, only scheduled appointments. To get on those lists, you can go through your MyChart account. If you don't have internet, you can call 1-800-Lakeland, and someone will walk you through, or actually they'll get you on that list and help you with that process. I think it's also important that if you're hearing this today and you're in a population where many of your friends and neighbors don't have access to internet or to electronic information, that you share this. Be that voice to your family member, be that voice to your neighbor and your community member. Help guide them in how to get on these lists. It can take a while after you get on a list till you get vaccinated, but at least getting there, then we know about you, and we can start to, as vaccine becomes available, we can reach out to you.
And it's worth noting that the Meyer in Benton Harbor is also providing vaccine each week, and there are Rite Aids across the state are receiving a small amount of vaccine, but we do have a couple of Rite Aids in Berrien County and Bridgman and Niles. I think those are the two. So there are other avenues, and we want you to be able to explore all of those. And I guess just for some closing thoughts, we are in a place right now that feels feels a little bit more okay. Our numbers are low. We have vaccine coming in. We've got more and more people being vaccinated and being covered at each week, but it does remain important for us to remain diligent with the social distancing, avoiding large crowds, wearing your mask, good hand hygiene. There are variants that are out there that are a bit more transmissible than what we may have become accustomed to last year at the beginning of the pandemic. It's important in workplaces to continue to maintain all of those practices to reduce spread. We're still in this period where we need to be doing all of the things, and hopefully this vaccine strategy, it will start paying dividends. It's just a matter of time. We're getting towards the end, but we still need to remain diligent so that our numbers do stay low.
Yeah, and I just add, stay vigilant and stay hopeful. You know, it really is a time for hope. I've had the privilege of going to some of these mass vaccination clinics, and the energy is palpable. Just the community members that are there receiving their vaccine, there's an excitement. The volunteers that are there giving of their time to vaccinate our community are excited to be there. So hope is, I think hope is the word for me right now, but don't lose sight of that vigilance to continue to wear your mask, to continue to socially distance. We don't want to see numbers start to go back up. We want to stay as open as we can be. And then we also know that mental health, substance use are up during this time. So if you need help, do reach out, contact your primary care, reach out to the many helplines that are available, go to the Berrien County Health website, go to the Lakeland website, identify those resources. But it's been a long haul. And if you're at a point where you need help, please reach out.
Well said.
Thank you. And thank you everyone for joining us today. Like we've mentioned, both the Berrien County Health Department and Spectrum Health Lakeland websites and Facebook pages remain a good resource throughout all of this for the most up-to-date information. And both organizations also have regular email newsletters that you're able to sign up for. As these changes continue to take place, we will keep everyone up to date. Thank you so much.